Hi, everyone. So we'll go ahead and get started. It's 1 o'clock. My name is Jenna Ungst. I'm the president of PathSig, and we're excited for today's pathology post-match panel discussion. Just as a reminder, the session is being recorded, so please make sure your microphones are muted during the session. It will be posted on YouTube as well as our website later this week for future viewing. We want to thank you all for your attendance, and we hope this session is helpful for those who are participating in PathMatch 26. Now I'd just like to go ahead and turn it over to Ting and all of our PathSig members who will introduce themselves.
Hi, I'm Ting, and I will be the moderator today. And could the other members of PathSig just introduce themselves?
Hi, my name is Joy. I'm also on the Pathology e-board. I'm one of the co-social chair members.
Hello, I'm Julia. I am another one of the social media co-chair members.
Hello, I'm Daniel. I'm the education coordinator.
Thank you guys so much. And now I would like to ask each of our panelists to introduce themselves, where they went to school, and where they will be going for residency.
Hey everyone, I'm Aaron. I'm also the vice president of this group, so happy to be on as a panelist today. I go to the University of North Carolina for medical school, and I matched at Johns Hopkins.
My name's Jacob. I'm going to UACOM in Phoenix and match at Tucson.
Hey team, my name's Adam. I go to Rocky Vista University College of Osteopathic Medicine's Southern Utah campus, and I matched at the University of Michigan.
Hi, I'm Cameron. I go to CUNY School of Medicine and I matched at NYU School Grossman in Manhattan.
Hey everyone, my name is Nisa Quintanilla Arteaga. I go to Loyola University Chicago Stritch School of Medicine and I matched at Northwestern.
Hi everyone, I'm Maya Handberry Howard. I attend Mercer University in Macon, Georgia, and I matched at the University of Alabama in Birmingham.
Thank you all so much for joining us. So let's begin with some of the questions that we have for you all today. The first question is for Aaron. How are you spending your time between now and the start of residency to best prepare for your new role as a pathology resident?
Yeah, that's a great question, and I'm still trying to figure that out. I think it just depends on the person, on what, works best for yourself. But personally, I'm taking time off. Yesterday was my official last day of medical school. So, taking time off to just relax and kind of, regather myself before the busyness of residency begins. My wife and I are going to go on a trip down to Florida and, just spend time relaxing. But at the same time, getting all of my ducks in a row. I'm having to move to a different state. So finding housing, getting plugged in with the people at my new institution. So just trying to juggle all of that, but mainly just taking it easy until residency starts.
Our next question is for Adam. Did online interviews make ranking decisions harder?
Yeah, I don't know. I didn't do it a different way, so that's all I know. But I did two away rotations at institutions that I interviewed with, and it was really, really hard to rank institutions that I hadn't been to above those places that I was more familiar with. I did end up doing that. I did not do an away rotation at University of Michigan, so I'm still a little bit nervous about it. But I did go to a second look day, so I think that you can gather a lot from a program, and I think it depends too on your values and what you care about, right? Like I have two little kids, so cost of living was huge, and you can get a lot of that from researching on the internet and understanding that. So that was a big deal for us. So you can get a lot of it, but I would say that when you are to the point where you're trying to decide between number one, number two, like the top of your rank list, definitely take advantage of second look day opportunities if you can, because ranking a program number one that you've never been to is kind of scary. I didn't do that. I did go to a second look day, which was helpful. So
personally, I didn't have any difficulty ranking without seeing the campuses. I think that a lot of the programs are really good about presenting about their institution and the program in the beginning of the interview. Some were better than others, and some programs have no information at all, which is not helpful. So it definitely depends on the program and how much information they offer during the interview.
I know Adam just mentioned about the second look day. Can you explain a little bit what that is?
Right. Yeah, I forget. Like this last year, you learned so much about the process. So how this generally goes is in the fall, right? In September, you'll submit your applications. In October, generally, you'll get invited to do interviews. And then through kind of December, into January, you'll do your online interviews. And then after interviews are over, generally in like February, before you have to submit your rank list, programs will invite you to come to their campus for a non-evaluative second look day, which means that you go there and the deal typically is that they at least tell you that they've locked their rank list. So you go and they're not interviewing you anymore. It's just your opportunity to talk to people at the program, speak with residents, tour the facilities, get a look around the city. And that is just a thing that you can do to inform your decision. It depends on the program on whether that is funded or not. I think most of them will not fund you to travel for second look days, but some of them will provide some compensation for you to travel to see them.
Programs also deal with second look days differently. So like University of Michigan, like Adam said, they welcomed people to come, but there's other schools that I reached out to that said, hey, we are not allowing anyone to come for a second look. There can be no formal second look. Don't reach out to us about it. Another one said, you can come, but you just have to like reach out to the residents and it's kind of like an informal thing. So I think they're all still kind of figuring out how they're going to do it. And I'm not sure exactly how it's going to fall next year. But if you apply and a program you want to do a second look at isn't offering one, that's not out of the ordinary.
Thank you for that. Let's move on to the next question. And this one, if Maya could begin answering this one. What questions were most helpful to ask residency programs to find if a program was a good fit for you?
That's a really great question and a very important question. Some of my mentors along my interview trail sort of told me, think about the 3 Ps: person, program, and then place. So take the opportunity during your interviews to ask all the things that you want in your career. Ask if they have specific research opportunities if you want, teaching opportunities, things like that. And just think about what you want in a program and even certain things built into the curriculum. For people, ask if they do things outside of the program together and plan things, and if they're family oriented, if you have kids or planning to have kids. We're kind of in this era where everybody's kind of getting married or doing other life milestones. And then the place, ask what exciting things are available in this place to live. You're going to be there for 4+ years if you decide to do fellowship or anything later on. So, make sure you want to live there and they have all the things you want, whether that's hiking or farmers markets on the weekends and things like that. So just really take the time to reflect and figure out what you want in your life. This is your first sort of big person job, and some people are moving across the country or moving to different states. So just make sure that you'll be happy with majority of the things that are offered.
Something that a program director actually recommended I ask the resident what the culture is like. And another example is like if you requested PTO, what would the response be, or how would somebody answer your request? So I thought that was helpful.
And also ask the residents if they're happy. Even the program directors and people during interviews will tell you to ask them that.
Thank you. And the other question we have is for Nisa, if you can start us off, is what are the most important features in an applicant and how does this differ US student or an IMG?
I love this question, but also as a disclaimer, I'm not an IMG, so I can speak about my experience or what my thoughts are, but I'm not sure if it would differ. I feel like in general for pathology, programs want to see enthusiasm for the field and they want to see that applicants have done the work to understand what pathology is, what the work is, and what training in pathology would be like. I think showing enthusiasm through your application, whether that's electives that you've done, research, activities, volunteering, whatever it is, goes a long way to show the program directors that you know what you're getting yourself into and what the work is in pathology and what you'll be doing. I think that when you're interviewing, you should show that you've done your research into pathology and that you want to be a pathologist. That's my opinion on what the most important thing is for an applicant to show, enthusiasm, and how that manifests is kind of up to you. Is it through your research, if it's through your electives, through your ways, through your personal statement. I mean, personal statement is huge as well. I think across the board, whether you're a USMD, USDO, or IMG, showing that you want to be a pathologist because you've thought of everything else and have excluded everything else and have locked into pathology. I think that's kind of my take on that. I don't know if the other panelists have any thoughts to add.
Yeah, I think you hit the nail on the head. Some advice I got before starting interviews is, like you said, enthusiasm for pathology, but at the same time, you don't want to convey to the people interviewing you that pathology is just because you didn't like anything else. Like you went through your third year rotations and you didn't want to do surgery or internal medicine or OB-GYN, and then you were just stuck with radiology or pathology basically at that point. I got quite a few questions throughout the interview season saying like, if you didn't do pathology, what other medical specialty do you think you would have gone into? And I think a lot of what they were trying to get at with that question is making sure that, you do have interest in medicine outside of just pathology. And it wasn't just like a choice of exclusion after all the other specialties were marked out. But the other thing is, I think the hobbies section is really important in ERAS. I got more questions, I think, about my hobbies and interests outside of medicine than I did about, my research or rotations in pathology. And then when I went on my second looks, they remembered, you like Lord of the Rings. You're the guy who likes the Lord of the Rings. Yeah, that's me. So it kind of is a way to just be more personable and people can remember you that way as well.
Thank you. And the next question is kind of along the same lines. If Cami can start the discussion for it, is can you discuss which types of work or volunteer experiences are beneficial to include on a CV?
Sure. So my work and volunteer section in my ERAS was quite extensive. I've been working since I was 18, so I pretty much put every prominent role I've had in the last 10 years and left out like the less prominent ones. So like, I didn't put that I was a hostess, but I put that I was an adjunct professor for anatomy. So I think that teaching is an invaluable asset to your CV. I think that it's a great experience to have, and a lot of pathology people look for teaching experience because pathology is so teaching heavy. And then for volunteer, I think that having something that shows a holistic view of who you are as an applicant and what matters to you most is really important too. So something that you're passionate about, something that you dedicate your free time to is important to put on your CV. Not everything needs to be pathology related, but if it can be applied to being a good holistic physician, I think that's important.
I think something that I would add to this, I agree with everything Cami said, is that you don't have to do a million things just to fluff out that section or to fluff out your CV. If you're passionate about one or two things and you believe very strongly in that volunteer work or that research that you're doing or whatever, that's fine and that's great. And I think that there are ways to make that shine and come through in your application and your interviews. Don't fall into the trap that you need to do all of these different things because you need all of these different, types of volunteering or types of research or whatever. Find what interests you and what you're passionate about in pathology, outside of pathology. Like Cami said, it doesn't have to be pathology related. And then, do that and put that in your ERAS.
Thank you. And I'm not sure if everybody are looking at the chat, but Jenna has put in some good resources from Match to Path in the chat. And for our next question, if Erin can start the discussion on fourth year rotations. So how many fourth year rotations did you do? How did you go about securing these rotations? Did you set up all of your rotations through VSLO or did you reach out to institutions individually?
So I think I did 8 total rotations during fourth year, and half of those were pathology related. So I did like a surge path, a heme path, and then 2 autopsy rotations. Those were all through my institution. So I don't have much experience with VSLO. I know Adam, didn't you do a couple of away rotations? So you might have some more insight into how that process works.
Yeah, I used VSLO so much. It was horrible. Not a fan. The 2 away rotations I ended up attending, I actually did not secure through VSLO. I rotated at Stanford and Johns Hopkins, both of whom do not use VSLO for their away rotations. I did secure other away rotations through VSLO and ended up not going to those in the end. You can do it both ways. Like if there's a program you want to go see and they don't have something on VSLO, like just go look at their website and usually they'll have a way that you can find out how you can do that process. But overall, it kind of just sucks. And it's way better to just have a home institution you can do rotations at.
I wanted to add to that as well. My home institution has no pathology department. I applied through VSLO. I didn't hear back from a single one. So the two rotations I did, one was a funded position through Mosaic program, which I think is a New York State program. So if you're in New York State, it's worth looking into. And then the other one was actually through a connection that I had met in real life. So don't put your networking to the wayside for away rotations. Use networking, use who you know to go and get experience.
Thank you. This is for all the panelists. Any advice for how to excel during these audition rotations?
Be yourself. Let your personality shine because they're also looking to see if you will fit in with the rest of the residents who you will be with for majority of the time. So really just let your personality shine and enjoy, have fun during the interview, ask questions. Someone mentioned hobbies and things like that. See like if you have any similarities between some of, especially during the resident panels, because most interviews will have like where you can just ask questions to the residents. Be yourself and have fun during the process. You worked hard and you're there, so deserve it.
I can add to that a little bit. I had a lot of questions from students at my institution about this. And so I made a YouTube video that is me rambling about this topic for like a half hour. So I'm gonna put that in the chat. I'm not good at this. This is not my thing. So, but if you want to like more details about surgical pathology weight rotations, I do talk about that for a long time. In general, I agree with Maya that the biggest thing is just being yourself, and your attitude is another thing. I think a lot of people that go to these have like never had a job before. I think the most important thing to remember is that you are at somebody's workplace, right? Like this is their job. These people are just trying to get through their day, and it is not about you. Like you're there, and that's really kind of them to allow you to like participate in any way and learn. But I think where medical students really go wrong on these away rotations is when they think that the whole experience is about them and they feel entitled to people's time or attention or resources. And that's not how you should approach this. You should be very grateful and just be aware that everybody is like trying to go home and go to lunch. So like don't ask a really long, complicated question at 1 o'clock after everybody's been in sign out for 5 hours and nobody wants to talk anymore. So just stuff like that, right? Like just kind of be self-aware.
Be nice to everyone, be polite to everyone, be yourself. If you skew more towards the introverted side, like I do, I know how much of an effort it is to like put yourself out there and try to talk to residents and try to talk to the attendings and get to know people, but just try your best. The away is your chance to get a good feel of what the program is like and what it would be like for you to be there, as much as it is for them to see how enthusiastic you are about the field. So be brave and be bold because this is your chance. So be kind to everyone, be kind to yourself, learn as much as you can. Do your best, really. Everybody is so nice. So just don't be scared, but do your best.
Thank you. How did you all approach signaling?
One of the things that my institution recommended, and I expect a lot of people here did, is I think it's called Residency Explorer. They have programs can choose to publish data around who they interviewed and then who matched their relative to what the signals were. And so I factored in both where I wanted to interview the most and what those programs said. So for example, when I did the open house for the University of Pittsburgh, the PD specifically said, I do not care about signals. I do not look at the signals. And so she was like, do not waste a signal on my program. And so I didn't, and I still had an interview there. Whereas the program that I matched at in Tucson, when I talked to them, when I did my rotation with them, the administrative director for the department said, we really care about signals. We're a small program. A lot of people don't really actually want to come live in Tucson. And so we really want to see if someone signaled our program or not. And so for them, they almost only interviewed people with signals. There's also geographic signaling, and I kind of approached that the same way. I know there was one program that I looked at and I was able to determine that they really cared about the geographic signal, but not so much about the individual program signal. And so I didn't signal them, but I signaled their region because I wanted to interview there. And then I did get an interview there. So I would use that as a resource for you when you're approaching signaling. And the one other thing I'll say is The programs know you only have 5 signals, unlike other specialties where you have like 15 or something. So they know that just because you didn't give them a signal doesn't mean you don't want to interview there. You still apply. They know you only had 5.
You do have an option in geographic preferencing to select no geographic preference. And I just want to touch on this real quick that I really agonized over this because I really didn't care which part of the country I ended up in. You should absolutely not select that option. I was advised about that by multiple program directors that they do not like to see that. So even if you don't have geographic areas that you really care about, just pick the 3 programs that you want to go to the most and geo-preference those regions. So that's just one thing I want to throw in there that I would strongly advise against not selecting that option.
Thank you. So how did you feel out if a site was a good fit and if they treated their residents well?
Kind of asked every program for the residents and the faculties to sort of give me their strengths and their weaknesses of the program. Because I wanted to see, and a lot of people struggle with the weaknesses part because it forced them to kind of think about, okay, either even if it wasn't a weakness, something that they wanted to improve or something that they weren't happy with. So that's a way to kind of get to a little bit of, information that, because everybody's telling you all the great things about the program, but ask about those weaknesses.
To add on to that, most of the programs that I interviewed at, they had like either the night before or at lunchtime the day of dedicated time for the interviewees to meet with current residents. And in my experience, the residents are very candid and it's pretty easy to get a feel from them, even if it's somewhat subtle as to how they're doing. Like you can just look at their faces. Are they super tired? Are they enthusiastic about talking about their program? And I thought that was really helpful just to get a feel. And like Maya, you said, asking questions, they're most of the time upfront and honest.
How many residents show up to those panels is also kind of indicative. You can kind of read between the lines of what time of day it is, if they're running in wearing surge path scrub, or if, they're showing up and they're joking around with each other, like, oh, you can kind of read between the lines, or you can just ask them more direct questions. I think the social hour with the residents is really key. And a lot of times they'll do that solo where it's just the residents without any other like program directors in the room or on the Zoom. So it's a generally safe space to ask your questions, but be very professional when you're asking your questions. Phrasing your questions in such a way that is still professional and polite is the way to go.
I think that you should identify for you like what it means for a program to be toxic. What are things that you're worried about experiencing in your workplace? And then ask direct questions about that. Like for me, I hate being made to feel stupid. Like I want a place where I can feel comfortable making mistakes. So in all of my interviews, I would ask the residents in those resident breakouts, I would ask them like, hey, if you're like a 3rd-year resident and you miss a really obvious diagnosis at sign out, like do you have any attendings that are going to like yell at you or like belittle you? Obviously, you're going to want to improve, but how does that go? Because we all make mistakes. We're all still learners. And that was a very telling question for me. And I learned a lot from that. So just kind of identify what you're trying to avoid in a workplace, and then you can ask really direct questions about that kind of stuff.
Thank you. Those are all really great advice and things that I didn't think about before. And our next question is, how did you prepare for residency interviews? Did you have any memorable interview experiences?
2 of the things I wanted to say about this question was, it does help to, even if it feels silly, to like practice with a family member or someone else with some of like, the common interview questions like, why do you want to go to this program? Why do you want to do pathology? What would you do if you didn't do pathology? What would you do if you didn't do pathology? I think another thing to think about is scheduling your interviews so that I scheduled mine so that a program or 2 that I applied to, but I didn't think was going to be my first choice, and I had an interview at, I put them as my first interviews, and that ended up being to my benefit because there's, one, I kind of had to work out the kinks a little bit in some of my answers. And there's things that are like, okay, I'm not going to talk about that at any more interviews based off of how the conversation went with the faculty after I shared that particular part of my life. So for me, that was helpful. And I guess also on interview timing, like the programs you probably want to impress the most, I'd say put your interviews towards like the middle or towards the end of your interview season if you can, but not like the very end or the very beginning, because either you're kind of tired of interviews or you get the kinks worked out. But those are my first thoughts.
This question hits me hard a little bit because I wish that I had done practice Zoom interviews just so that I can get a sense of my mannerisms. I talk with my hands a lot and I move around a lot when I talk. It's just the way that I express myself. But I wasn't quite aware of just how much I move and when I speak and kind of just all the little things that I do. And so please practice with someone before you sit for your interviews, or, just record yourself and then watch it. As cringe as that might be, just do it. And then also, please, for the love of pathology or whatever you hold dear to your heart, do not sit in a swivel chair when you are sitting for your virtual interviews, because I sit in a swivel chair and I move around a lot. And in one of my interviews, the person that was interviewing me stopped the interview to tell me that I was moving around too much and it was distracting and I was swiveling back and forth. And I was horrified and I wanted to die in that moment. So it's fine, right? But just don't sit in a swivel chair and practice, or just do a practice session with yourself or somebody else, and just watch out for all of the little things that you might not be aware of that you're doing, and then look into the camera while you're talking to your interviewer.
Match to Path has residency interview boot camp that they put on in the fall. They go through getting like a light for your interview. So those might be a good resource as well if everybody wants to look at the Match to Path website.
I absolutely have memorable interview experiences. One of my very last interviews was with a program that was towards the bottom of my list, kind of from the get-go. And I had 5 faculty interviews, which is, a little bit above average. Usually it's 3 or 4, and they were each 20 minutes. And every single one of my interviewers started the interview by asking me if I had any questions, and refused to engage with any of my attempts to, anyways, asked lots of questions for forever. And I got to the 5th interviewer and they started it the same way after I had been asking questions for 80 minutes. And I said, I've had plenty of opportunities to have my questions answered. I have no more prepared questions today. If you have any questions for me, that would be great. And they said, nope, I just want you to have the opportunity to have your questions answered. I'm like, okay, then, well, if you have things you need to do today, like, I don't have any more questions. And then we signed off the interview. So that did cement them at the bottom of my rank list. So, interviews are fun. That was my memorable experience.
I had a really difficult time always having questions ready during interviews. So I had a Word document pulled up that I could reference. And I mean, every single interview session throughout the different days, I asked the same questions and I tried to sprinkle them in to all of my different interviewers. But there were points where I ran out of questions. Hey, those were all the questions that I had prepared for today. Do you have any questions for me, or something like that? Because it is difficult to keep on, but you don't want to have a lull in your interview.
One thing I didn't expect, but ended up being, I guess, a good, memorable experience is on several of my interviews when people would ask me about my hobbies. At one of them, someone asked me like if I had any pictures or anything like that. And so I would like share my screen and show them a picture or two from my hobby. And for people that I had met outside of interviews that then happened to be interviewing me, I would also like show them a picture of my family, because that was important to me. And people really liked that. I'd be like, okay, here's this thing that I'm doing, and here's, why I like it, and let me explain this little part about it. So not that that will necessarily happen, but it could be good to have like 2 or 3 pictures of your hobbies, ready to go. You probably have already taken them anyway if it's a hobby you actually enjoy.
Yeah, having things in the background. My background is pretty cluttered now because interviews are over, but having general things in the background that people can point out or ask about in case there's a lull in the interview or conversation, or they see all the books in my background, they ask me what I've been reading or if I can recommend anything. And, it's just a way to keep the conversation moving, especially if it has to do with your hobbies. I think that's, in my opinion, a great way to talk about yourself as a person and kind of find a common ground for a really good conversation in your interview.
You want to be professional, like you don't want things to be distracting. I had like Lego sets and like Warhammer figures in my background during interviews. Yeah, you had to be looking for them to find them, but people who were looking for them definitely talked about them. So yeah, don't feel like you have to have like, socially acceptable in all situations stuff behind you, as long as it's professional.
And what tips do you all have for navigating the application timeline, interview scheduling, and did the programs give you guys ample options?
The advice I got from my advisor was put your top choice program somewhere in the middle, so that way you and that way you're also not burned out. Unfortunately, when I got the link to schedule for my top choice, which was NYU, it was actually my first interview, and I had no other spots had already been taken. So sometimes it is a bit of a luck of the draw how soon you open your email. But if you're in clinical rotations, you can't be glued to your phone and you can't be opening emails constantly. So I never had a difficulty scheduling interviews. I was always able to schedule an interview, maybe just not my preferred date.
Yeah, this last year they had upwards of 90% of programs release their interview invites on the interview release day, which is mid-October, maybe. Unclear if that'll continue for the next cycle or if more programs or all programs will be participating in that. In theory, it's really nice because you can just wait for that one day and then, get all of your interview invites. Not every program participated, so there were, a smattering here and there around that date. If you can get that day off from whatever rotations you're on, clerkship, electives, or whatever, so you can sit at your computer, then that would be great or ideal. There's the release day, but there's no set time that the interviews come out on. Something that happened to me was I got an interview at 6 in the morning and I was asleep. They'll come out at different points throughout the day, and you want to ideally be able to schedule as soon as possible, or else the spots get taken and then you just get what you get. Not sure what's going to happen for the next cycle, so just keep your eyes peeled for any announcements about that.
Hopefully they move it off of everybody's CAP travel day this next year.
How did you guys approach creating your rank list? Were there any specific criteria or considerations that weighed heavily in your decision-making process?
It depends on the person. For me, location was very important. My wife and I are both from North Carolina, and family is here. We didn't want to move too far away, like to California, even though I'm sure there are lots of great programs out that way. Personally, for me, location and then strength of CP training was very important. I think as you go through and researching different programs, you'll find that most places have great AP training, but CP is a little bit more variable, I feel like. So those were two things for me, but I think it just depends on you if you're interested in forensics. Do they send residents out to do fellowships in forensics, or really it just depends on whatever you're interested in.
Yeah, I'm a numbers person. This is probably crazy, but I kind of made like a systematic list. I had all of my programs and I put all the things that I wanted in a program and kind of just gave them a tally to things just so I could visually see like what program checked off most of my boxes. Since I was able to take the location part of it out because I didn't apply anywhere where I didn't want to live and where my husband wasn't willing to live too. So I was able to take that out, thankfully. But yeah, just checked off whether it was like the fellowships that I wanted or certain things built into the curriculum, like if they got transplant pathology in their search path or children pathology. So there's different things that you really want in a program. I kind of honed it down to that to make sure that I was getting everything I wanted and build my career. Try to figure out what's really important and then go from there.
Thank you. What advice do you all have for fellow medical students who are currently in the process of preparing their applications for PathMatch 26?
Start now. You want to get as many eyes on your written materials as possible. In my opinion, that does not mean that you do everything that everybody tells you to do. Ideally, like I sent my personal statement to 18 people, I think, and my rule was I would change something if like 3 people said the same thing. You want to get drafts ready and you want to just like have as many people look at your stuff as are willing to do it. That's the most important thing. If you're doing it last minute, like that's going to suck. So try not to do that.
I would definitely second that. Start early, and also that gives you the opportunity to come back and look at things several times where you're not just looking at it in a condensed amount of time. Because if you leave it for a little bit, come back later, you may see something you missed the last 5 times you looked at something. So yes, and recheck everything. Spelling, just make sure there's no typos or anything like that. So start early so you have time to come back with a fresh set of eyes every time you look at it. And yeah, just go day by day, little by little.
As a certified anxious girly, I made lists of things that I needed to make sure that I had done. So, asking for your letters, updating your CV so that you can send your CV to your letter writers, drafting your personal statement. You can look at the application on ERA as like a PDF version of it just to see what's going to be on there, figuring out what your experiences are going to be and what your activities and all of that stuff. Needing transcripts, what transcripts do you need? So USMLE, getting your headshot taken, all of those things that need to be done and need to be uploaded to ERAS as well before the programs download everything. So it really is up to you how you organize yourself. I need lists so that I can visually see like, okay, yes, I did that. And kind of almost every step in between. So for example, I think you need to assign your signals before you submit ERAs. So like little things like that, like if you submit before you assign your signals, then it's gone forever and you can't do your signals anymore. So just knowing all the little steps are in between really helped me organize yourself, start early, like everybody's been saying. Once all of that drama is done, you can just have fun on the interview trail, but set yourself up for success early.
I would second getting your stuff in before the deadline because you'll hear programs say, yeah, you can submit stuff afterwards. And like my advisor also said, you can submit stuff afterwards, but most programs will do a big batch download of all of the applications the day that they're available, and then may or may not go back and renew the information that's been put in since then. So you can't count on the letter you upload 2 weeks later to ever actually be read.
Speaking of letter of recommendations, I had a question from the chat. How many letter of recommendations should be from a pathologist versus another physician? And are non-clinical letter of recs at all valuable?
I think having letters from people who know you well and who can speak to your strengths and your enthusiasm for pathology would be great. Ideally, at least one from a pathologist and one from a non-pathologist. I feel like every program will have different preferences for what letters they want. I ended up having 3 pathology letters and 1 family medicine letter. So it really just depends who can speak to your abilities and who would write a good letter for you. One of them should be from a pathologist, I think.
And also make sure you all do your research and like look at what the schools prefer. Some programs may say, oh, like we want 2 letters from your preclinical years and one from your clinical years, or they'll say if they have preferences for the letters, find people around that so it kind of fits all of the places that you're applying to.
If you don't
One
do that
thing,
research and you apply and they go, oh, they didn't read our letter requirements, so that's automatically a mark against you.
one thing that I would recommend if you are coming from a institution that's not quite as academic, like a private, small, tiny DO school that nobody's ever heard of, and you want to go to a large academic institution, an aspect of that is that they want to know if you can function in an academic setting. Ideally, one of your pathology letters should be from an academic pathologist and not just a community pathologist. I had one from the community pathologist at our local hospital and one from my away rotation. And I would say that the letter that I got from Johns Hopkins was probably the most impactful part of my application. That's something that you definitely want to think about if you can make something like that happen.
One question was submitted about how much the bi-weekly paycheck is after taxes, roughly. So our panelists haven't quite started yet, so it's hard to say. But your best resource would be at the program's websites for salary and benefits. I think those are usually listed. Additionally, we had a question about dual applying. This question might be best for our next fall program director panel to avoid misinformation, but we'll pass this question along to our new executive board to address during the fall. And then we currently don't have any IMG applicants on this panel, but we did have some IMG related questions that were submitted. And I'm not sure how comfortable our panelists feel about answering these, but there was one about finding rotations and observerships for both US and IMGs. Match to Path would be the best resource for IMGs.
I can't really speak to that, but what I could say is trying to reach out to IMGs that are in residency programs or, reaching out to one of us if we know people in residency programs that are IMGs, because they could actually answer your question a little bit better. So that's one approach you could have.
Thank you. And the question that was submitted in the chat was from an IMG who applied in both the 2024 and 2025 match cycles without success. She completed 2 U.S. clinical rotations in pathology and has several pathology-related experiences in their home country. She's currently involved in research. What would you recommend to strengthen her application for the 3rd attempt? Are there specific strategies or experiences that could make a significant difference for the next match cycle?
Obviously, we are missing quite a few details here. I think that in general, the question is how many interviews you're getting, right? Like if you're getting 10 interviews with your application, I would recommend focusing on your interview skills. If you're not getting any interviews, then maybe there's some other red flag that we're not aware of here, because that all sounds great. You're doing all the right things, getting pathology experiences, doing some research. And if you don't have any academic red flags, right, that's the other thing that would matter, I would say.
Thank you, Adam. Just a couple more questions. If you had multiple interviews scheduled for the same day and you couldn't attend both, how do you go about prioritizing or choosing which one to attend?
Well, the first thing I'd say is do not schedule 2 interviews on one day. I mean, if you absolutely have to, I'd reach out to the one that you are less interested in first. As soon as you know about this conflict, and tell them, hey, I'm having some conflict scheduling my interviews. Are there other dates that would be available that I could find? I would approach it that way rather than trying to somehow do both of the interviews. Some of the places don't tell you exactly what the interview schedule is going to be until pretty close to the date. Some schools only want you on the interview for an hour or two. Some schools want to do a bunch of presentations and like send you a Grubhub card so you can eat lunch with residents over Zoom, and then it's got a 6-hour thing. And you don't necessarily know that until the day of.
How many away rotations do you all recommend to complete as a medical student?
At least one, especially if you are at an institution that there is no pathology program, so you really aren't getting that experience. At least do one. I feel like most programs during my interviews, they would say that they wanted to see their applicants were interested in pathology by having some type of experience, whether that's a rotation or shadowing, at least one.
If you don't have a pathology program and your experience is with pathologists in the community setting or in the practice setting, like that's great, but you have no idea what a pathology residency looks like. And that is not okay going into pathology residency interviews. So you need to find some way to understand kind of how the training process looks and works. And so an away rotation is great, just so that you don't look like you don't know what you're doing when you are in interviews. It gives you a lot of perspective and things to ask about and care about and respond to questions with.
As we wrap things up, do our panelists have any last minute thoughts?
I think that this process can be really overwhelming. It's expensive, and it's really easy to compare yourself to other applicants. Take the time to reflect on your accomplishments thus far. Medical school is really hard. This process is really hard. Reflect on your journey so far and give yourself a round of applause for all the hard work you've put in.
I 100% agree with that. I remember being in these kinds of things for the past couple of years and seeing the panelists and thinking that they were pretty cool and that I was not going to be like them. And now here I am. And I bet any of us could 20 minutes, 30 minutes tell you about why we should not have ended up right here, right now. We all have weaknesses and we all have issues. And so nobody's perfect, and you've done some awesome things. So I totally agree with Cami. That was great.
One thing that came to mind was, let's say you're at the end of this process, you've interviewed and you're doing your rank list. Really try to rank stuff based on where you actually want to be, and kind of like Adam was saying, where you feel like would be the best for you personally, for your growth and for your profession. That may not be at the big academic center. That may be at a more mid-tier center or something else. It just depends on what you want out of things and what your personality is. And that can be okay if that's how you want to rank things. If you don't want to put the big name programs first just because they're big names, that shouldn't be the only reason you put something first on your rank list.
Great. Thank you all so much. On behalf of PathSig, we just want to thank everyone for attending and the panelists for providing such great information. We wish you all the best of luck as you begin residency training. We're very proud of you all. Just as a reminder, this session was recorded and we're going to put it online here in the next few days, like I said, on YouTube as well as our website. We'll be releasing registration information for any additional events in the next coming months. So just keep an eye out on PathSig through our social media platforms as well as the website for additional information. Some of our panelists are sharing emails in the chat, so feel free to take those down if you have any additional questions for them. And with that, I'm going to stop the recording and thank you all so much and best of luck with your future.